Welcome to another edition of SCHA's Capitol Beat, a brief update on activities in and around the State House. Last week, the General Assembly got off to a rather slow start because of the winter storm. The House and Senate met briefly on Tuesday, and Wednesday was mostly taken up with inaugural activities. Although a slow week legislatively, it was a big week for Governor Haley, with two of her signature issues getting quick action in the House and Senate. The House quickly passed and sent to the Senate a bill that would require roll call votes on certain spending bills. The Senate adopted their own rule that requires a recorded vote on second reading bills. Governor Haley also chaired her first Budget Control Board meeting, where a new executive director was elected. Allan, former insurance commissioner, replaces Frank Fusco in that position. She also announced the appointment of Bob Toomey as head of the Department of Alcohol and Drug Abuse. Bob's father was a longtime CEO of the Greenville Hospital System, and Bob has worked with SCHA on many issues. On Thursday, the House Ways and Means Committee met for about 5 hours to hear budget presentations from agencies in the education and healthcare areas. The Department of Health and Human Services presented their current deficit situation, as well as an explanation of their budget request for next year. The committee members asked several questions, many centering around the announced reductions in some of the optional programs. This coming week, subcommittees will begin hearing budget presentations from state agencies. We will keep you up to speed when those agencies most critical to our efforts will be presenting their budgets. Also on Thursday of this week, the Senate Medical Affairs Committee will hold a confirmation hearing for Tony Keck, Governor Haley's selection for Director of Health and Human Services. Outside the General Assembly, the SCHA Board met on Wednesday and approved a statement regarding potential cuts to the Medicaid program. The Board recognizes the financial crisis facing state government and wants to work with state leaders and other Medicaid providers to develop reasonable alternatives that minimize the impact that reductions in payments could have on the entire program. SCHA member hospitals would prefer to temporarily increase the $264 million they are currently contributing to the program than have the Medicaid payments paid to them reduced. We will begin communicating that message to legislative leaders as they begin work on the budget. Thanks again for tuning in, and remember, we depend on you and others in your facility to help us communicate our message to our friends in the legislature.